Hello everyone, I'm Eiichiro Osa. I will talk about Japanese hospitals and nursing homes during COVID-19 pandemic. I'm an accountant, specializes in healthcare management. I have clients which are hospitals, clinics, and nursing homes. I also have ACLS qualification. ACLS stands for Advanced Cardiovascular Life Support, like life-saving qualification. Because I have this qualification, I want to understand the feelings of medical staff. This is a situation of reservation center of vaccination. Actually, my mother is 76 years old. It took 2 days to make a reservation of vaccination. She lives in Shinjuku Ward in Tokyo. It is very crowded to make a reservation system. At first, she connected internet, but it is very crowded internet reservation system. Instead, she called again and again for 2 days. Finally, she could make a reservation, fortunately. But other elderly people don't access to make a reservation. IT system is far behind other countries. That's a problem in Japan. Divided three parts. Firstly, a comparison with other countries, especially between Japan and Germany. Secondly, current situation in Japan. Last week, this was Golden Week in Japan. Golden Week to take a holiday for a week. Long holiday. Lastly, management status of Japanese hospitals. I'm accountant, so I have knowledge of management status. So I'll show you on this statement. Firstly, comparison with other countries. According to this chart, infected COVID-19 people per million people, Germany is more than Japan. But recent situation is different. In Japan, 12% increase. Germany, 3.1% decrease. Especially last week, Golden Week, Japanese government declared the state of emergency, but some Japanese people didn't follow it. Some people traveled in Japan, and some people went on shopping, and so on. So, this week and next week, it will be a severe condition in Japan. According to this chart, transition of Israel infected people. In Israel, vaccination is proceeded 60%. Because of this high vaccination rate, infected people was declined compared to highest number, 98% decrease. Vaccination is earlier than other countries. First vaccination began in last December. On the other hand, in Japan, vaccination began in February for essential healthcare workers. In Japan, second stage, elderly people are vaccinated now, but it is very hard for them to make a reservation now. This graph shows vaccination rate in the total population compared with other countries. Israel and US is more than Germany and Japan. Recent data in Japan, only 2% to 3% vaccination of total population. Very low, lower than other countries. I think Tokyo Olympic will hold in this July, but very difficult for them to hold. This picture shows Israel's restaurant situation recently. I'm jealous of them because they can eat at the restaurant without mask and no limited people to eat at the restaurant. On the other hand, in Japan, with mask eating, Japanese government recommends us to eat at the restaurant with mask. If they want to speak with mask, if they eat something without mask. But this situation is very funny. I don't agree with this style, but this situation is very common in Japan. This graph shows total number of Japanese corona clusters until February 15th this year. There are total number 5,100 cases, clusters in Japan. Number 1, nursing home, followed by restaurant, company, hospital. As you probably know, there are a lot of elderly people to live in Japan. They will have COVID-19. They will be severe condition in nursing home and hospital. So we have to consider taking measure for elderly people to prevent infection. According to this chart, we have a lot of acute beds compared with other countries, including Germany and US. However, we don't have enough doctors in Japan, less than other countries, US, Germany, and US. On the other hand, Germany is good balance. Acute beds is more than US, and doctors more than Japan and US. Let's change the topic. I'll talk about current situation in Japan. Status of medical restrictions or medical suspension in Tokyo and Osaka. Tokyo is center of Japan, capital of Japan. Osaka is second biggest prefecture in Japan. Both of the prefecture difficult situation to accept more patients with COVID-19 nowadays. He is private hospital manager in Osaka. He said, this is like disaster state because they don't afford to accept more patients. If they have stroke, heart attacks, and other severe disease, they don't take to the hospital. So, severe situation in Osaka. I'll show you COVID-19 infection cases. Number 1, nursing home. 42 people COVID-19 positive in Tokyo. 1 month business restriction in Tokyo. Second case, hospital, 5 COVID-19 positive patients in Hyogo. 2 weeks restriction. Better way to prevent infection in this hospital in Hyogo rather than this number 1 case nursing home. I'll show you nursing home case. This graph shows 42 COVID-19 patients graph. At first, staff was infected COVID-19 and infected other people, staff and elderly people. This situation is common. At first, staff was infected and infected other people. In nursing home, there are a lot of elderly people over 80 years old. They usually have dementia. So, it is very hard for them prevent infection. They wear masks every time, very difficult. So, infected other people easily. in nursing home. There are three major risks of cluster. Firstly, quarantine period. They have to be off for 14 days in nursing homes and hospitals. There are not enough staff in the hospital and nursing homes. So, quarantine period 14 days is very severe for them. Secondly, decline in profits or sales in the hospitals and nursing homes. If there are clusters, it is very hard for them to accept new patients and new residents. Lastly, a claim for damages by family. If patients or residents die, their family claim for damages to hospitals or nursing homes. This is common problem in Japan. Okay, I'll show you one case in Kumamoto. It takes about 1.5 from Tokyo to Kumamoto by airplane. There is a nursing home in Kumamoto. They have 60 rooms, including single room and multi-rooms. There were a COVID-19 outbreak cluster in January 6 this year. But there are no doctors and not enough nurses in this nursing home. Very difficult situation in January. Full patients in the hospital. So it's very difficult for them to accept more patients. Finally, 35 COVID-19 positive patients. Fortunately, 25 people take to the hospital, but 10 people have to stay at nursing home. They don't have any equipments to cure patients. So this nursing home asked any help. Same group hospital. Fortunately, a neighbor hospital helped this nursing home. Due to COVID-19 outbreak, this nursing home learned a lot of things. For one thing, to prevent infections, they have to wear masks and face shields, especially in close with elderly people. They have to wear mask and face shield. And also, they encourage elderly people to wear mask too. But elderly people don't follow it every time. Secondly, they learn all single room is better to prevent infection. This human hospital only has all single room. Nursing home has multi rooms, so very difficult for them to prevent infection. Let's change the topic. I talk about management status of Japanese hospitals. According to this chart, hospital profit fell sharply from 2019 to 2020. In April and May, 10% to 13% decrease because last April and May, state of emergency was declared by a Japanese government. They postponed surgery in April and May, and they also postponed medical checkup. Factors behind the decrease in sales. Firstly, extension of a prescription period. If they have chronic disease, they get medicine for a month. But during the COVID-19 pandemic, they don't want to see a doctor. So they want to extend prescription period from a month to 3 months. Secondly, any patients differing from consultation. If they have a mild disease called high temperature, diarrhea, they go to drugstore instead of going to clinic or hospital. Lastly, increased home care. If they have cancer at terminal stage, before COVID-19 pandemic, they went to hospital to hospitalize at terminal stage. But during COVID-19 pandemic, visiting restriction in hospital. So it's very hard for family to meet face to face at hospital. So family choose to care at home. This situation is seen in the hospital. Online meeting between patient and family. Visiting restriction. So instead, family communicate with patients online. Elderly people don't know how to use it. Honestly, they want to meet with patients face to face. Finally, I'll talk about the conclusion. Running from COVID-19. Firstly, speed. Speed is very slow in Japan, especially Japanese government. Vaccination schedule is very late, later than other countries. Nowadays, elderly people access to make a reservation by phone or internet, but confused. It is very crowded to make a reservation. IT is also problem. To make a reservation by phone, very old system. I think IT is better, especially Line is better. Line is SNS system. Most of us have a Line system. So instead of phone, we have to make a reservation by Line. Lastly, pressure from society in Japan. This means if they wear mask, other people follow it. Other people also wear mask. This was good situation last year, but recent situation, bad things, pressure from society. Last week, long holiday. Some people traveled in Japan, and other people followed it, so infected other people easily. This situation, Japanese government have only one option to prevent infection. Vaccination is very important, but very difficult for us to get a vaccination at once. Okay, I talked about the COVID-19 situation in Japan. If you have any questions, comment on this YouTube. Thank you for listening and watching. See you next time. I'll show you another English video if you like. Thank you.